On today's show, we take a closer look at the use of biologics or monoclonal antibodies in the treatment of chronic rhinosinusitis with nasal polyps, which is also called CRSwNP. We'll be asking, what value do biologics bring in the treatment of CRSwNP? What caveats are there to their use in these patients? And what role do registries play in managing the disease? Do they help to improve patient care? So, what is a patient registry? Well, it's a database, a collection of standardized information about a group of patients who share a condition or experience. Registries are of prime importance in comparing the effectiveness of different treatments. So perhaps I could start by saying, look, we already do randomized controlled trials or RCTs, so why do we need real-world data via these registries?
So usually randomized clinical trials are designed in order to demonstrate efficacy of a new medication, having the highest reliability. And for this reason, they include highly selective population basing on stringent inclusion and exclusion criteria, and they are managed in a closely controlled setting.
So tell me, what is the Italian registry aiming at, and what are the expected outcomes?
So our first aim is to collect as much data as possible. We are conscious that if we want to obtain significant real-world evidence, we need a large amount of real-world data. The methodology is different from randomized clinical trial, and the real-world experience are less restrictive, so we need more and more data to reach a good evidence.
So do you think biologics will replace the need for sinus surgery? And how do you see the future of sinus surgery for CRSwNP in the era of biologics?
So that's an interesting question, because ENT are afraid about that point. This is a critical point. I believe that we have to think about new algorithm. I believe if a patient has never received surgery in his life, it is appropriate to propose at least one adequate surgery. If the patient is not fitting for surgery for very well-defined reason, so we could propose firstly biologics, but we have to think about very carefully to this detail.